Is it time to reevaluate the way we live with COVID-19? Some doctors are now convinced that the lockdown measures meant to protect us from the virus could actually be hurting us. Instead of sheltering all of us, should we just be sheltering some of us?
I see no reason why swimming pools should be closed. Chlorinated water is like the best way to kill coronavirus.
Dr. Ioannidis believes many of our current restrictions are unnecessary and not actually supported by science.
People going to the beach to enjoy nature, something that has practically absolutely no risk.
He's an infectious disease expert and professor of medicine at Stanford. Dr. Ioannidis and dozens of his colleagues at universities like Harvard, Yale, and UCLA say it's time for a more targeted lockdown, with stronger measures for the most vulnerable people and fewer restrictions for everyone else.
We know that 95% of the population has practically minimal risk.
Because of that, he believes most indoor facilities can reopen safely, including restaurants, bars, gyms, and even schools.
There are health officers all throughout the Bay Area that would argue these restrictions are actually saving lives.
I believe that many measures within the bundle of shelter-in-place do save lives. But there can be many negative ramifications and many negative consequences from stay-at-home and lockdown orders. We know far better who we need to protect, but at the same time, the large majority of the population should be allowed to go back to their lives. So it's unlikely that in the current situation we are really saving lives. I think that probably we're killing people by following some of these measures forever.
Killing people?
I think eventually we do.
You don't want to run?
Courtney Patel is convinced her husband died because of fears created by the lockdown.
We kissed and to say goodbye, and he said, "I love you," and then he went down.
That morning, her husband Dominic suffered chest pains, but he refused to go to the hospital. Like so many people, he worried about catching the coronavirus.
I do think that messaging, played into that fear of and the reluctancy of just, acting on those symptoms sooner and even calling 911 sooner.
By nightfall, Dominic was in serious pain. Against his wishes, his wife called 911. As the EMTs prepared to take him to the hospital, Dominic died of a heart attack at home. He was just 38 years old.
Absolutely, we have seen the negative impact of people being fearful of medical care.
Dr. Chris Caldwell is chief of emergency medicine at San Francisco General Hospital.
Have you had patients die that you think likely may have survived had they come here earlier?
Absolutely, absolutely. And I would say it's not just a few of those. At least every week we are seeing somebody who is going to suffer and is suffering severe consequences from having delayed care for fear of coming to the hospital.
29% of Americans are avoiding or delaying medical care due to fear of catching the coronavirus.
We have to balance everything, and I believe that in the current situation, prolonged lockdowns are going to do enormous harm to health and more.
My name is Dr. Yeadon. My original training was a first-class honours degree in biochemistry and toxicology, followed by a research-based PhD into respiratory pharmacology. And after that, I've worked my entire life on the research side of the pharmaceutical industry, both big pharma and also biotech. My specific focus has been inflammation, immunology, allergy, in the context of respiratory diseases, so the lung, but also the skin. So I would say I'm a kind of a deeply experienced inflammation, immunology, pulmonology kind of research person. As the virus swept towards the UK in the late winter and early spring, I too was concerned because at the time we were told perhaps 3% might die. So when the Prime Minister called for a lockdown, I wasn't pleased about it, but I understood that we should try this. But it's important that you understand that when we look at the profile of the pandemic as it passed through the population, that it was clear that the number of infections every day was falling. We'd passed the peak quite a long time before lockdown started. So we took all that pain, that lockdown pain, which was multiple weeks, I don't remember exactly how many, multiple weeks, we took it for nothing. If there was a really important effect of lockdown on the number of people who died or the rate of it, you should at least be able to order them, like these people had lockdown and these didn't. And you cannot. All heavily infected countries' shapes are the same, whether they had lockdown or not. They don't work. I don't know why anyone is allowing you to be pushed into this corner.